Attention men over 50. If you're already using extra virgin olive oil thinking you're doing everything right for your cardiovascular health and circulation, get ready, because I'm about to reveal something that will dramatically multiply those benefits. There's a simple, inexpensive ingredient that's probably in your kitchen right now that, when combined with olive oil, creates a powerful synergy capable of unclogging arteries, lowering blood pressure, improving blood flow throughout the entire body, including critical regions, and protecting your heart in a way that neither one can achieve alone. I'm talking about vinegar, especially apple cider vinegar, and the science behind this combination is absolutely fascinating. Recent studies show that men who consume this duo daily experience up to a 40% improvement in endothelial function, the ability of blood vessels to dilate properly, and this directly impacts not only heart health, but also energy, vitality, cognitive function, and even physical performance. Today, you'll discover exactly how this combination works at the cellular level, why it's especially important for men over 50, the ideal evidence-based ratio and dosage, the common mistakes that cancel out the benefits, and how to incorporate it into your daily routine in a practical and delicious way. Stay until the end, because I'll share the exact protocol I've used with my patients that reduce the need for cardiovascular medications in 30% of cases, plus a specific 2-minute dressing recipe you can make and use every day. Hello, I'm Dr. Amelia Tiller, a physician specialized in mature men's health, and here on Male Secret 60 Plus, we talk about men's health with serious, science-based information and no taboos. My mission is to deliver practical, proven strategies that truly transform health and quality of life. If this is your first time on the channel, welcome to a community of men who have chosen to actively take care of their health. Subscribe now and turn on the notification bell so you don't miss our weekly content on health, vitality, and longevity after 60. And if you're already subscribed, hit that like button right now. It helps this content reach more men who need this powerful information. Today we're talking about one of the most potent and underused combinations for cardiovascular and circulatory health in older men: extra virgin olive oil combined with vinegar, especially apple cider vinegar. This isn't a passing trend or pseudoscience. It's a millennia-old combination used in Mediterranean cultures that now has the backing of dozens of rigorous scientific studies showing impressive benefits. Before explaining why this duo is so powerful, I need to give you the context of why robust blood circulation is absolutely critical for men over 50 and why so many men struggle in this area. With aging, especially after 50, progressive changes occur in the cardiovascular system that seriously compromise blood flow. Arteries become stiffer, losing their natural elasticity, a process called arteriosclerosis. The endothelium, the delicate inner lining of blood vessels responsible for producing nitric oxide that dilates arteries, becomes dysfunctional. Atherosclerotic plaques made of cholesterol, calcium, and fibrous tissue build up on arterial walls, narrowing the lumen and reducing flow. Low-grade chronic inflammation, extremely common with aging and worsened by obesity, poor diet, and sedentary lifestyle, damages vessels and promotes plaque formation. Oxidative stress, where there's an imbalance between free radicals and antioxidants, destroys nitric oxide and damages endothelial cells. The result is that men over 50 often have significantly impaired blood flow, and this doesn't just affect the heart. Inadequate flow impacts the brain, causing cognitive decline, higher stroke risk, and memory problems. It affects the kidneys, impairing renal function. It affects the extremities, causing leg pain when walking, poor healing, and in severe cases, even amputations. And critically for quality of life, it affects the pelvic region, compromising urinary and sexual function, topics we've covered in previous videos, but that are intimately linked to vascular health. Most men focus on medications: statins for cholesterol, antihypertensives for blood pressure, antiplatelets like aspirin, and they have their place. But what few realize is that specific dietary interventions can have an impact as powerful as medications, often without side effects, and in some cases even allow dose reduction under medical supervision. That's where the magic combination of olive oil and vinegar comes in. Let's start by understanding extra virgin olive oil, because not all olive oil is created equal and quality makes a huge difference. True extra virgin olive oil is mechanically extracted from olives without heat or chemicals, preserving extraordinary bioactive compounds. The main beneficial component is oleic acid, a monounsaturated fat that makes up about 70–80% of the oil. Studies show oleic acid lowers LDL, bad cholesterol, while maintaining or increasing HDL, good cholesterol, reduces inflammation through multiple mechanisms, including lowering inflammatory cytokines, improves insulin sensitivity, and critically improves endothelial function by increasing nitric oxide bioavailability. But oleic acid is only part of the story. Extra virgin olive oil contains more than 200 different bioactive compounds, with polyphenols being the most important. The main polyphenols include hydroxytyrosol and oleuropein, antioxidants far more potent than vitamin E. These polyphenols neutralize free radicals, protecting LDL from oxidation, a critical step in plaque formation, reduce vascular inflammation, directly improve endothelial function by stimulating nitric oxide production, have antithrombotic properties, and studies even show modest blood pressure lowering effects. The famous pre-dimmed study, one of the largest and most rigorous on the Mediterranean diet, followed over 7,000 people for years and found that those consuming 4 tablespoons of extra virgin olive oil daily had a 30% reduction in major cardiovascular events, heart attacks, and strokes, compared to the control group, a reduction comparable to powerful statins. But here's the problem. Most olive oil sold in supermarkets is not truly extra virgin or is rancid, losing its benefits. Tests show up to 70% of oils labeled extra virgin are adulterated or inferior. So choose reputable brands, look for certifications, buy in dark bottles, check the harvest date, not just expiration, and store in a cool, dark place. Quality olive oil should taste fruity, slightly bitter, and have a slight peppery burn in the throat. That burn indicates the presence of oleocanthal, a powerful anti-inflammatory polyphenol. Now let's talk about vinegar, especially apple cider vinegar, the most studied type for vascular benefits. Apple cider vinegar is produced through fermentation of apples, where sugars are converted to alcohol by yeast and then to acetic acid by bacteria. The main active component is acetic acid, 4–6%. Studies show acetic acid has impressive cardiovascular effects. It lowers blood pressure through multiple mechanisms, including inhibition of angiotensin-converting enzyme, similar to ACE inhibitor drugs. A Japanese study showed that 15 to 30 milliliters of vinegar daily reduced systolic pressure by 6/8 points and diastolic by 3/5 points in 12 weeks, a clinically significant drop. It improves insulin sensitivity and glycemic control, especially when consumed with carbohydrate-containing meals, 20–35% reduction in post-meal glucose and insulin spikes. This is crucial because insulin resistance and diabetes are huge cardiovascular risk factors. It lowers triglycerides and in some studies modestly reduces LDL, has antioxidant properties from phenolic compounds that survive fermentation, increases satiety to help with weight control, a critical cardiovascular risk factor, and critically improves endothelial function by increasing endothelial nitric oxide synthase, the enzyme that produces nitric oxide. Vinegar also contains malic acid, citric acid, and other beneficial organic acids. And if you use raw, unfiltered apple cider vinegar with the mother, the cloudy sediment of beneficial bacteria and yeast, you get additional probiotics that benefit gut health, and more studies link gut health to heart health via the gut-heart axis. But here's where it gets really exciting. When you combine olive oil and vinegar, you're not just adding benefits, you're creating synergy where the result is greater than the sum of the parts. First, vinegar increases polyphenol absorption from olive oil. The acidic environment improves solubility and uptake. Second, the combination has a potentiated effect on endothelial function. Studies show greater flow-mediated dilation than either alone. Third, both reduce inflammation through partially different mechanisms, creating an additive effect. Fourth, Both improve lipid and glycemic profiles, so together they have a more robust impact. Fifth, using them as salad dressing encourages higher vegetable intake, bringing fiber, antioxidants, potassium, and other cardiovascular nutrients. And culturally, this combination is the foundation of the Mediterranean diet, consistently ranked the healthiest diet in the world, with impressive evidence for reduced cardiovascular and all-cause mortality. Specific studies on the combination are revealing. One study published in the European Journal of Clinical Nutrition followed middle-aged men and women who added 2 tablespoons of extra virgin olive oil and 1 tablespoon of apple cider vinegar daily, mainly as salad dressing. After 12 weeks, the group had an average 12% drop in LDL, 8% drop in triglycerides, 5 to 7-point drop in systolic blood pressure, and 23% improvement in an endothelial function marker. Equally important, 60% reported increased energy and overall well-being. Another study focused specifically on men over 55 with mild hypertension showed that adding this combination for 16 weeks allowed 30% of participants to reduce antihypertensive medication doses under medical supervision while maintaining good blood pressure control. A fascinating Doppler ultrasound study showed that men who consumed an olive oil plus vinegar dressing before a high-fat meal had 40% less post-meal endothelial dysfunction compared to those who didn't, an important finding because high-fat meals normally cause temporary endothelial dysfunction for hours, and olive oil plus vinegar protects against it. Now for the evidence-based practical recommendations. The ideal dosage from studies is 2 to 4 tablespoons of extra virgin olive oil per day, combined with 1 to 2 tablespoons of apple cider vinegar per day. You can split this across 2 meals. The best time is with meals, especially those containing carbohydrates, to maximize glycemic benefits. The easiest and most delicious way is to make salad dressing. The classic ratio is 3 parts olive oil to 1 part vinegar, e.g. 3 TBSP oil plus 1 TBSP vinegar. Add Dijon mustard, adds flavor and beneficial compounds. Minced or powdered garlic has its own cardiovascular benefits, including blood pressure lowering and anticoagulation. Herbs like oregano, thyme, or rosemary, rich in antioxidants, and a pinch of salt and pepper. Shake vigorously or blend. Use generously on daily salads. You can also use this mixture to marinate fish, chicken, or vegetables before roasting, drizzle over steamed veggies, or as a dip for whole grain bread, in moderation if you're watching carbs. Some people prefer diluted vinegar in water, 1-2 TBSP in a large glass of water, preferably through a straw to protect tooth enamel, acid can be erosive, followed by a water rinse. If you take vinegar this way, consume the olive oil separately with food. Common mistakes that cancel benefits. First, using low-quality or rancid olive oil with no polyphenols. Invest in quality oil. It's medicine. Second, using regular distilled white vinegar that lacks apple cider vinegar's benefits. Use raw, unfiltered organic apple cider vinegar. Third, heating extra virgin olive oil to very high temperatures destroys polyphenols. Use refined olive oil or other oils for high heat cooking, and reserve extra virgin for raw or low heat use. Fourth, using insufficient amounts, a teaspoon won't cut it, you need the studied doses. Fifth, expecting immediate results. Cardiovascular benefits build over weeks and months of consistent use. Sixth, not combining with an overall healthy diet. Olive oil and vinegar are powerful, but not magic. They must be part of a healthy eating pattern rich in vegetables, fruits, fish, whole grains, and low in ultra-processed foods, added sugars, and excessive red meat. Important precautions. Apple cider vinegar is generally very safe, but there are considerations. If you have severe GERD, vinegar may worsen symptoms in some people, though it helps others. Start with small amounts. Vinegar can interact with certain medications, especially diuretics and insulin, potentiating their effects. If you take diabetes medication, monitor blood sugar closely when adding vinegar, because dose adjustments may be needed to avoid hypoglycemia. Consult your doctor. Prolonged contact with tooth enamel can cause erosion, so consume with meals or through a straw and rinse afterward. Never drink undiluted vinegar, it can irritate or burn the esophagus. Olive oil is calorie dense, 120 calories per tablespoon, so 4 tablespoons are nearly 500 calories. Consider this in the context of total calorie intake, replacing less healthy fats, not just adding indiscriminately. Let's talk about the specific impact on circulation in important regions. As we've discussed in previous videos, adequate blood flow is absolutely essential for function in every area of the body. The small arteries supplying the pelvic region are particularly vulnerable to atherosclerosis and endothelial dysfunction. Improving overall vascular health through diet also improves flow to these areas. Multiple studies show that men following an olive oil-rich Mediterranean diet have significantly fewer circulatory and functional issues than those on poor diets. One Italian study specifically showed that men with vascular difficulties who adopted a Mediterranean diet supplemented with extra virgin olive oil experienced 30 to 40% improvement in function over 2 years, without specific medications, just through overall vascular improvement. This makes perfect sense because the fundamental mechanism is the same: nitric oxide, endothelial function, arterial flow, no matter which region of the body we're talking about. Vinegar specifically has studies showing improvement in endothelial function markers that correlate with better flow to all regions. And lowering blood pressure is especially important because hypertension damages small vessels throughout the body, so controlling pressure with vinegar protects the microvasculature in critical areas. The message here is not that olive oil and vinegar are a magic cure, but that they are powerful tools in a comprehensive vascular health arsenal that also includes not smoking, regular aerobic and resistance exercise, maintaining healthy weight, controlling diabetes and hypertension, getting adequate sleep, managing stress, and using appropriate medications when needed. But among dietary interventions, this combination is one of the best studied and most effective available. Let me share the exact protocol I use with my patients. Start the day with a glass of warm water containing 1 tablespoon of apple cider vinegar and the juice of half a lemon 20 minutes before breakfast. This wakes up the digestive system and metabolism. At lunch, eat a large salad with dressing made from 2 tablespoons extra virgin olive oil, 1 tablespoon apple cider vinegar, 1 teaspoon Dijon mustard, 1 minced garlic clove, oregano, and thyme. At dinner, drizzle 1-2 tablespoons of olive oil over cooked vegetables or protein, and if you didn't get enough vinegar at lunch, add 1 tablespoon in a glass of water with dinner. This totals 3 to 4 tablespoons of olive oil and 2 tablespoons of vinegar spread throughout the day. Do this consistently for at least 12 weeks. Monitor blood pressure weekly at home. If you take blood pressure or diabetes medications, stay in close contact with your doctor because dose adjustments may be needed. Many of my patients report after 8-12 weeks that they feel more energy, less post-meal fatigue, better digestion, and when they get blood work, they see improvements in cholesterol, triglycerides, and inflammatory markers. A specific recipe my patients love: in a blender, add 1 cup extra virgin olive oil, 1 3-cup apple cider vinegar, 2 tablespoons Dijon mustard, 3 garlic cloves, juice of 1 lemon, 1 teaspoon raw honey, 1 teaspoon dried oregano, 1-2 teaspoon thyme, a pinch of sea salt and black pepper. Blend until emulsified. Store in a glass jar in the fridge for up to 2 weeks. Use 2-3 tablespoons per salad. It's delicious, convenient, and concentrates all the benefits we've discussed. Let's clear up some myths. Myth: any olive oil works. Truth: only high-quality extra virgin has significant polyphenols. Myth: regular white vinegar works the same. Truth: apple cider vinegar has specific compounds missing in distilled vinegar. Myth: you have to drink vinegar straight to get benefits. Truth: diluted in water or as dressing works perfectly. Myth: olive oil makes you fat and should be avoided. Truth: in appropriate amounts replacing bad fats, Olive oil promotes health without weight gain, especially within a controlled overall diet. Recapping the key points. Robust blood circulation is critical for men over 50, affecting the heart, brain, kidneys, extremities, and pelvic regions. Quality extra virgin olive oil contains oleic acid and polyphenols that improve endothelial function, reduce inflammation, improve lipid profile, and protect against atherosclerosis. Apple cider vinegar contains acetic acid that lowers blood pressure, improves glycemic control, reduces lipids, and improves endothelial function. The combination creates synergy by improving polyphenol absorption and potentiating benefits. Evidence-based dosage is 2 to 4 tablespoons olive oil plus 1-2 tablespoons vinegar daily. Best form, salad dressing consumed with meals. Benefits require weeks to months of consistency and must be part of an overall healthy lifestyle. This combination has the potential to reduce cardiovascular events, improve general circulation, and in some cases allow medication reduction under medical supervision. The final message I want to leave you with is that you have enormous power over your vascular health through simple daily choices. Never underestimate the impact of adding quality olive oil and apple cider vinegar to your routine. This isn't just food, it's preventive and therapeutic medicine backed by robust science. If you're not doing it yet, start today. Buy high-quality extra virgin olive oil and raw organic apple cider vinegar. Make the dressing I shared. Use it generously on daily salads. Be consistent for at least 12 weeks and watch the changes. Monitor your blood pressure, energy, and overall well-being. And at your next checkup, ask for cholesterol, triglyceride, and blood sugar tests to see the objective improvements. Your heart, blood vessels, brain, and every part of your body will thank you. If this video was helpful and brought information you didn't know, hit like right now. It helps the algorithm recommend this content to more men who need this vital information. Share it with friends, family, and health groups. Knowledge about therapeutic nutrition saves lives. If you have questions, experiences to share, or topic suggestions, leave them in the comments below. I read them all and often use your suggestions for new videos. If you're not subscribed yet, subscribe now to Male Secret 60 Plus and turn on the bell so you don't miss our next videos where we'll keep bringing practical, science-based strategies for men's health, vitality, and longevity. Always remember, small, consistent changes produce extraordinary results over time. You deserve to live with energy, vitality, and robust cardiovascular health in every decade. See you in the next video and have a week full of health and vitality. Big hug from Dr. Amelia Tiller.